Welcome back. The Guest House Ocala provides treatment to those who suffer from self-defeating behaviors brought on by trauma. Dr. Doug Davies with the Guest House Ocala is joining us now to tell us a little more about it. So welcome to the show. Great to have you here.
Thank you. It's great to be able to share some messages about healing from trauma and addiction.
Absolutely. Well, tell me a little bit more about Guest House and how you work with patients on an individual basis.
So I'm the medical director there, and I have the privilege of meeting them when they first land on property. So, you know, what people really care about is are they safe with you, and do you really care about them? So it's such a great opportunity to do a very deep, emotional, intimate dive with them and try to get them off to a really good start.
Yeah. Well, tell me a little bit more about your background and how it helps you with what you do there at Guest House.
Well, perhaps the piece of my background that helps me the most is the fact that I was that person sitting on my couch 27 years ago and went through my own recovery process. So that helps a great deal to understand. And then I retrained in addiction medicine. I'm a member of the American Society of Addiction Medicine, and it's important to stay on top of the, you know, what's going on with the latest research. There are scientists devoted to studying the brain and where every neuron goes, every connection mapping the brain. You know how far they've gotten with that?
How far?
The fruit fly.
Oh boy, we got some work to do, huh?
The brain of a fruit fly is as far as we've gotten. So it's important, and it's important to stay on top of the trends. There's crazy things out there these days with kratom, with xylazine, basically a veterinary anesthetic. The things that are doping the country's drug supply are really more frightening than ever.
Yeah, that's why you need an expert like yourself. And I know that the Guest House really prides itself on individualized care. Why is that approach so important?
Well, again, it's really important to let the person know that you understand them and what they've been through. So long before I sit down with a patient, I've spent a good hour or two reading through what did they tell our admissions team when they called on the phone, what records might we have from you know, their own docs at home, or if they're in another facility. I read through everything, get to know them as well as I possibly can, so that when I sit down, it really flows and they tell I care, and that I've spent some time trying to find out about them.
Yeah, I know we've been looking at some video of the gorgeous property out there, 52 acres. Talk a little bit about the setting and how that plays into the treatment.
Well, it's really important for people to be able to disconnect from the distractions, from their environment, and completely devote themselves eating, sleeping, breathing, recovery, critical to doing this work, because we're asking them to go to some very deep places, and it's so important to pull back from all the distractions and responsibilities of daily life.
Yeah. Now, you were telling me earlier that people who often come to Guest House, this isn't their first treatment plan. They've been other places. So do you handle or coordinate transfers?
Yeah, sometimes it's their first time around, and sometimes not. I absolutely love to collaborate with either outside providers who have already taken care of the people, a psychiatrist, a trusted therapist. There's no sense in recreating the wheel.
Yeah.
And then I also spend time, if a family member drops them off to treatment, I take the family member aside and give them a chance to talk, maybe for the first time in their lives, about, you know, what's been going on, what are their concerns for their loved one, what do they think we should be focusing on. So yeah, collaboration's so important.
Yeah, and what advice do you have for someone who may be watching who is ashamed to reach out for help?
So what we're figuring out about addiction in a nutshell is it's from birth. It's being born with low dopamine tone in a critical area in the brain. It's nobody's fault you've got the disease. It's really important, though, that you step up, learn about it, and take care of it. So not your fault. That's what I want people to know. And lose the shame, because all the shame does is further depress the dopamine tone.
Yeah. Well, thank you so much for sharing all that information with us today. So important. And if you would like to learn more, just head to their website, theguesthouseocala.com.